Today we have Dr. Abboud. He's an oculofacial surgeon, and I'm so excited that he's here today. Good morning, Doctor.
Good morning. Thanks for having me.
Absolutely. Can you please tell our listeners a little bit about yourself?
Sure. My name is Jean-Paul Abboud. I'm an oculofacial plastic surgeon here in Del Mar, San Diego. I'm originally from Lebanon, so I was born there. I came out, or actually, my parents brought me out to Lebanon to the United States when I was just an infant. That was during the Civil War in Lebanon, and I grew up in New Jersey. That's where I went to undergrad at Rutgers. I did my medical school there, as well as a PhD in biomedical engineering at the combined Rutgers Princeton University Physician-Scientist program. Then I did my internship there at Rutgers as well in general surgery before coming out here to San Diego at the University of California, San Diego, where I did my ophthalmology training, residency training, and followed by a fellowship in oculofacial plastic surgery at West Virginia University. Once I was done with my fellowship, I came out here to San Diego, started my practice, oculofacial surgical arts, and here we are.
Okay.
Yeah.
Now, did you always know that that's what you wanted to do, that that was the direction you wanted to go?
Well, I always wanted to combine my sense of artistry with medicine, and plastic surgery seemed to be the best fit. Now, my PhD in biomedical engineering was on the neural development of the retina, and so that's where I gained appreciation um, on the eye. And so from there, it kind of combined the eye and plastic surgery, and that's how we came up with the oculofacial plastic surgery path.
Okay, nice. Okay, so what's trending in cosmetic eye procedures right now?
Well, currently, the what's really trending is a return to natural appearance. We're seeing a lot of people, especially celebrities now, dissolving all the fillers that they've had because we've seen celebrities that have been overfilled with fillers. Fillers have caused puffiness, contour abnormalities, and just these short-term fixes are causing long-term issues. So now more and more the trend is to resort to permanent fixes that are going to give you long-term, natural, safer results. So we're seeing more of what's called preservation blepharoplasty. So in the lower lids, for instance, instead of removing that fat, we're preserving that fat. We're shifting it around and redraping it to soften, the hollows under the eyes. In the upper eyelid, we're also preserving the fat. Just removing too much causes hollowing. The skin, for instance, on the lower lids, we're doing a CO2 laser resurfacing also to help prevent removing too much skin, which can cause issues like eyelid malposition, especially as patients age.
Okay.
Yeah.
So are patients asking for anything like surprising and or unusual, you think?
I do get occasionally these looks that are very much influenced by influencers and celebrities, such as the fox eye look or the cat eye look. Unfortunately, those are trends. So part of my job is to help patients understand what works well for them, what looks natural, and I try to push them away from these trends that just may not age so well with them.
Right. So it's like social media, does that influence it, do you think?
Yeah, social media is a double-edged sword. So there are a lot of celebrities out there and influencers that are pushing these looks that patients come in oftentimes with these screenshots and they want to have that look. But, these looks don't match the natural appearance, their natural anatomy. And on the other hand, however, social media is bringing awareness to patients. So patients are not shying away from asking questions about cosmetic eyelid surgery or seeking some answers to some issues and problems that they may have. But it also, patients are seeking out specialists who specialize in eyelid surgery, so it makes things a lot more streamlined for them, and they're seeking people who can truly deliver results that are safe, timeless, and authentic.
So what are the most exciting innovations in oculofacial surgery right now?
Right now, the most exciting innovation is a shift towards regenerative medicine. So, fat grafting, microfat, nanofat, and PRP, these have been used or are being used to complement surgery by, stimulating tissue repair at the cellular level. It improves skin quality and restores volume naturally. Now, these, however, are relatively new and they're still being tested. And so I do recommend that patients use these modalities with caution until they're tried and true to see, until the science fully catches up.
Okay. So, how do you think technology like robotics, AI, imaging change the way you approach procedures?
Sure. So one of the biggest advantages right now in imaging and oculofacial plastic surgery would be ultrasound. So with ultrasound, we're able to look for fillers that have been injected around the eyes, and we're starting to learn that fillers last way longer than initially they were advertised for. So we're seeing fillers placed 10, 15, 20 years ago. And so it helps better guide us to where these fillers are. We can also dissolve them and then, start off patients with a clean slate when they're undergoing surgery. In terms of robotics, there's really not much in the way of eyelid surgery that robotics has been helping with. And with AI has been a game changer for many industries, including eyelid surgery and medicine in general. Um, you know, AI now has been used to help us understand diseases and treat them more efficiently. I'm actually been working on a research project where I combine AI and machine learning with monitoring patients who have thyroid eye disease, which is a disease that can affect the eyelid and the eyeball movement. And so, using that, we're able to help patients monitor their disease progress and see what treatments work for them.
Wow. So, are there any new techniques or treatments that are revolutionizing the patient's outcome?
So the newest techniques now are, like I mentioned earlier, is shift towards preservation. The old subtractive way of eyelid surgery is kind of getting old fashioned because you are removing tissue that's valuable, especially around the eyes. So the fat repositioning for the lower lids keeps that natural volume intact. The upper eyelid as well, by preserving muscle, especially prevents patients from poor blinking and ability to close the eyes, and it preserves the health of the eyes as well. And combining laser resurfacing to treat the skin instead of just excising it also prevents further complications in the future in terms of eyelid retraction or eyelid malposition, and it preserves the integrity of the eyelid and the eyes, and it just ages better.
Okay.
Yeah.
So, what do you think a common misconception people have about oculofacial surgery?
A common misconception is that any surgeon, especially, even a board certified plastic surgeon, is equally qualified to do eyelid surgery. So there are oculofacial plastic surgeons who only specialize in advanced eyelid surgery. There's only about 800 of us worldwide. We spend about 5 years of our training doing surgery on the eyes and the area around the eyes. And by the time we're done with our training, we would have done well over 1,000 eyelid surgeries. General plastic surgeons, they spend on average about 1 to 2 months doing eyelid surgery rotations. So they finish their training with about a handful of eyelid surgeries. So for, anyone out there who's seeking eyelid surgery, I would recommend seeking a surgeon who is a fellow of the American Society of Ophthalmic Plastic Surgery, ASOPRS. These surgeons are the true eyelid experts, and they would provide the safest, most advanced techniques in eyelid surgery that are going to not only enhance your appearance, but also preserve the function of the eyelids.
Okay. So, how do you balance aesthetics with the function when working around the eye?
Balancing aesthetics with a function is at the heart of oculofacial plastic surgery. So, eyelids are not just cosmetic, they also serve a function. They serve a function in protecting the eyelids and managing the tears. So, any aggressive eyelid surgery is going to affect the integrity of the eye. Uh, and as an oculofacial plastic surgeon, we aim to first and foremost preserve and restore function of the eyelids. And then secondarily, that's where the aesthetic comes from. And that's where we can focus on, the eyelid crease, the contour, and symmetry. So function comes first, aesthetics comes second, and overall happiness and satisfaction of the patient and their safety is always the number one priority.
Okay. So I know that you've done volunteer work. I know you personally. Can you tell us where and what kind of impact that's had?
Yes, I do. I'm very fortunate to be involved in many surgical volunteer work, both here locally and globally. I've been to Mexico and Fiji. I also am part of the volunteer surgical team at Fresh Start, a program here at Rady Children's Hospital, where we provide reconstructive surgery for children who have um, both congenital and traumatic eye conditions. So been a really rewarding experience for me, and it just reminds me that why I went into medicine in the first place.
That's awesome. So, what advice would you give to young surgeons who want to give back and they don't know where to start?
The advice I'll give young surgeons is to start small and stay local. Mother Teresa said, if you can't feed 100 people, feed one. So start with one. And then slowly you can seek opportunities through hospitals, community programs, and then later you can go on, big international mission. But always, if you want to give back, just start with one.
So, what inspired you to get involved in your medical missions or community outreach? What was your inspiration?
What inspired me to get involved in medical missions? Well, it's nice to take a step back from aesthetic medicine. We tend to think that eyelid surgery is about perfection and luxury, but there is a true need out there, especially in underserved areas where patients don't have access to good quality healthcare. And been fortunate to have gained the skills that can not only make people look better, but could also make them feel more confident, and just restore the anatomy that they probably were not born with or due to trauma has changed and shifted. So it's really good to give back, especially when we take a kind of break from the aesthetic world.
And so, how do you think the experience of doing that has shaped your perspective as a surgeon?
Well, definitely keeps me grounded. That's for sure. And it's just a daily reminder that we live in a very fortunate part of the world, and then there are many people out there who are not as fortunate as we are. And so it just keeps me grounded, and it keeps me um, more patient, more compassionate, and more committed to serving the patient who's on the other side of the table.
Are there any memorable stories from your volunteer work that have stuck with you?
Yes, there is one memorable story about a family who I met in Fiji. They were shunned by the community. They're living in isolation basically because they had a condition called blepharophimosis syndrome, which is a genetic condition that causes their eyes to appear small. So they have very small eyes. And when I met them, I showed them pictures of my patients who had similar conditions who I operate on here in the US. And I told them this is not a curse. This is a genetic condition that I can help treat. And so you can almost hear the sigh of relief and that weight getting off their shoulder, just knowing that they're not the only ones out there and that they were not, in fact, cursed. And so during that trip, I ended up operating on a teenage girl, her father, two of her uncles, and I get to meet the whole family. And it was truly a life changing trip to Fiji. There's actually another story, a little bit more lighthearted, during my trip to Chiapas in Mexico, where I met this lovely 44-year-old lady who had congenital eyelitosis, which is drooping of the eyelids. And as we're going to the operating room, she grabs my arm and says, "Doctor, please make me look pretty. I need to find a husband." And so I took her to the operating room. Not only did I treat the ptosis, but I spent a little more time doing a nice little blepharoplasty and making things look pretty. And when everything was done and wheeling her out, I asked her, "Who's taking you home?" She said, "My husband." And I said, "Wait a minute. I thought you said you were looking for a husband." She said, "Yes, I want to find a new one." And so that's a good reminder that no good deed goes unpunished. Yeah,
That's funny.
yeah.
So, what would you say is one tool that you cannot live without in the OR?
The one tool that I cannot live without in the operating room would be my surgical loops. It allows me to see the delicate tissues of the eyes and allows me to perform my surgery with accuracy and precision. And it's becoming an extension of me, and I can't live without them in the operating room.
Okay. So, what would you say is the most underrated part of your job? Like a piece of advice you'd give to your younger self?
The most underrated part of my job is how much time and care I spend talking to patients and listening to them and managing their expectations. Because if patients walk through the door and they have expectations that just simply cannot be met with surgery, then they'll be unhappy and unsatisfied. So I feel that there is a good amount of time, even sometimes longer than the surgery itself, that needs to be spent with patients to educate them about what can realistically be achieved. Um, because no matter the surgery, how technically perfect the surgery is and how skilled the surgeon is, if those expectations are not met realistically, then the patient will be unsatisfied and happy and not happy.
So, just some fun questions. If you weren't a surgeon, what would you be doing for fun?
Well, if I weren't a surgeon, I would probably focus on something that's artistic, photography, painting, design, and that's why I got into oculofacial plastic surgery to begin with. I do love surgery, but I do like the non-clinical aesthetic side of things.
Okay.
So that's what I would do.
Okay. So, what's the weirdest or funniest request you've ever gotten from a patient?
One of the weirdest requests I got from a patient was a patient who brought in a screenshot of a before and after from a surgeon in Turkey. And there was one beautifully done blepharoplasty, nice incision, nice contour, and he had a big red X on it. And underneath, there was another blepharoplasty that he had performed where it had an exaggerated, lift to the tail that went all the way up to the brow. And it just looked very unnatural. And he had a big green check. And it just, that's what she wanted to go for, the exaggerated look. And at that point, we had a discussion, and eventually I had to turn her away because trends don't last. And my number one priority is to make sure that patients have the best results. They're going to last and they're going to be safe and natural looking.
Right. Absolutely. So, what do you feel is next in your career? I mean, are you anything coming up, conferences or?
Yeah, what's
Mhm.
next for me is basically growing my practice and expanding the ways I can treat patients more effectively and safely. I have plans at some point to create a state of the art center where I offer patients not only surgical treatments for their eyelids and face, but also complementary treatments that will maintain their results as well. So there are a lot of exciting things down the pipeline. My research as well that we talked about. I aim to, merge both my expertise in biomedical engineering and my clinical work to better serve the patients moving forward. Yeah.
So, if a person wants to find you, how do they find you?
Well, they can find me at my practice, Oculofacial Surgical Arts, here in Del Mar, San Diego. They can also get a lot of information on my website, www.oculofacialarts.com, as well as on my Instagram account, Oculofacial Arts, and YouTube, where they learn about new trends and the latest on oculofacial plastic surgery and facial aesthetics.
Awesome.
Yeah.
Well, Dr. Abboud, I think you're the best. And I'm so happy that you came to talk with me this morning.
Well, thank you so much. Thanks for having me. It
Absolutely.
was a pleasure.
Absolutely.
All right.
Thank you so much for listening to the House of Three Fates podcast. We appreciate you joining us today. We encourage you to stay connected by subscribing, liking, sharing, and following our journey and making sure to step into your best self with us next time. If you have any skincare inquiries or concerns, we are here to help. You can always send us an email at threefateswellnesscenter@gmail.com or DM us on our Instagram at House of Three Fates. Thank you for joining us, and we hope you'll join us next time.